so many options today, what we can do, not just for treatments, also including lifestyle changes. So I'm super excited to have you here, and I'm sure that you will be learning something hopefully new, and I would definitely love to have your feedback at the end, okay? So we're gonna get started now. We also have people who will be online. Hello! Okay, just come over. We have lots of chairs here for you. That's okay.
I'll turn that off.
Yes, please. Hello.
Hi.
We were just starting, okay? So
I'm sorry.
we're having all like female day today, okay? So we're gonna be talking about the female sexual wellness. The reason actually why I decided to talk about this topic in particular is through my years of working as a family physician, I started to see a lot of ladies suffering for so many years, and they never bother to ask a question because they were told before that this is how it goes when you are a female and you should suffer in silence. Hello, you can come over here.
Right here?
You can have a seat here or there.
You want us to come here?
Yeah, sure. Okay.
Sorry.
That's okay. We didn't get your name.
Miss Annie.
Oh, okay, and your name?
Remo.
Oh, okay, great. So let me give you like a quick introduction first before we get in. So my name is Dr. Marina Beshay. Some of you are new here and some of you have seen me so many times before. So I've been practicing as a family physician in Canada for so many years now. I started as a family physician in Newfoundland, and then I started my practice here in Barrie since 2017. I also do a lot of other services in addition to the family practice, which includes a lot of traditional medicine in my family practice, but I also do non-traditional medicine in terms of wellness, hormone replacement therapy, weight loss. We've been helping a lot of people all through those past so many years to feel better and look their best just as well. Okay, so as a female, I also realized that it's also very, very important for female to have this support, and this is why we're actually doing this event today. We're looking for this female to female support. We need to support each other. So please, if you have any questions that you don't want to have your name written on, please use one of these papers to write your question, and then I will be more than happy to answer that, okay? So questions and answers, we will look at them at the end. I will say if you have any question that come up to your mind, you can write it now, but make sure that you check it because I'm hoping that you will get your questions answered during the event we have, but just in case you still have any questions, please ask for sure, okay? So why women's wellness? That was the first thing. So through the years of my practice, I see a lot of ladies suffering in silence. Okay, so they suffer from vaginal dryness, dyspareunia, which is having painful sex. They have urinary incontinence, leakage. I have seen ladies in their 30s wearing diapers, and they started to get so frustrated, so depressed because they smell like they are almost like, they smell like pee. And that's definitely reflecting on their mental health. It's reflecting on how they look at themselves, and it's also reflecting on their confidence in the relationship. So it's a lot more than just taking care of one condition. It's all about how you look at yourself, the amount of confidence you have, and of course the quality of life. So I also saw ladies who stopped going to the gym because they can't do any exercise anymore. Every time they do any sort of exercise, they will have to leak, or if they have to go to the gym, they have to wear pads. So it's kind of a big issue, more than what we think. And like I said, when it comes to female, and especially if we have kids and we kind of work as a good mom, a lot of times we think that we shouldn't really take care of ourselves. We should just take care of our family. And this is not a good way of thinking about it. We should take care of ourselves so we can take care of our family around us. So yes, we go through changes, and these changes could be related to hormones, it could be related to aging, it could be related to having kids, it could be related to everything, but it's not okay to just suffer in silence because we should. When something happens to the male, they don't suffer in silence. They will be just speaking up. So it's our turn to take care of ourselves, okay? So the impact of age and hormones, this is definitely the big two factors that can actually affect how we feel, okay? So aging is a big thing. The reason why aging can definitely affect how we feel and why it affects our intimate relationship is through the years, we lose a lot of collagen from our body. We lose collagen from the age of 21. So starting from the age of 21, we started to lose 1 to 2% of the collagen every year. And this is why, if you look at your picture now and your picture, like let's say 20 years ago, you will definitely see some changes happening to your face. Because when we lose the collagen, we don't lose the collagen just from our pelvic floor muscles and our vaginal mucosa. We actually lose the collagen from everywhere. This is why our joints are changing, our skin is changing, even our internal organs are changing. Our brain and memory is also changing. So when we send someone for CAT scan for the brain, for example, because they have some memory issues, I usually say there is something called age-related changes. That's still acceptable because it's age-related. Don't think that your internal organs are looking perfectly fine when you are at the age of 80 and it will continue to function the same way as when you were 20 years old. It doesn't happen this way. Why? Because we go through a lot of changes, and this age changing are actually reflecting on all of our tissues, not just our bladder and pelvic floor muscles, okay? And the hormones are definitely a big thing. So the hormones, especially the estrogen hormone, is the female hormone that keeps lubricating our vaginal wall. So in order to have like a good, healthy, intimate relationship, we need to have good lubrication in our vaginal wall. And once that's stopping through the perimenopausal, so usually anywhere between like 40, 45 years old, we go to this perimenopausal stage. So you will definitely notice that even if you're not fully in the menopause, but the amount of lubrication you will have is never going to be exactly the same as it was when you were much younger. Why? Because there is definitely some changes happening to your body, and these changes are affecting everything. But something else maybe a lot of ladies don't know about is there is also hormonal changes that just not affecting your vaginal wall, but it's also reflecting on even the skin. So same as, same as how the skin is actually getting thinner, a lot thinner in our hands and our face, and we get the tidiness in our neck. Same thing happens to our skin down below. So we have a big group of muscle. This big group of muscle is supporting our bladder. It's keeping our bladder up. When we start to have the weakness, because we had babies that was just pushing on our bladder all the time, and we maybe had like an injury during the time of delivery, or we have weakness in our muscles here because we had a C-section, plus we also have some hormonal changes, plus the age changes that happens. All of these muscles are getting so much weaker. So imagine with me that we have like a lot of organs here in our stomach, and these organs are just pushing on these muscles that's already getting weaker. What's going to happen? Everything is going to start to fall down. So when things start to fall down, this is when we started to have what we call it prolapse. So prolapse basically means everything is just falling. But prolapse, of course, is the advanced definition. Like this is when things are really out. We don't want to wait till the prolapse to happen for sure, but what we want to do instead is we want to start working on these muscles to strengthen them and to tighten them. Because once we're able to tighten the muscles, we're going to be able to push things back to where it used to, which includes like our uterus, our bladder, everything inside here, okay? And this is what we will be talking about. So how we can do all of these changes, okay? So the symptoms are definitely so different between one patient to the other. But the most common symptoms that maybe a lot of us started to experience by now anyway could be leakage. When we cough, when we laugh, we might just have a little bit of dripping. A lot of ladies will start to wear some pads when they go to the gym or even outside just in case, because anything can happen at any time. If you start to wake up in the middle of the night to use the washroom, So you started to have this interrupted sleep, and then after the interrupted sleep, you're gonna wake up in the morning tired and exhausted because you didn't have a good solid sleep. This is all signs that you started to have these symptoms. This is all signs that your muscles here are getting weaker. If you're looking for the washroom, the first thing when you go anywhere, oh, where's the washroom? That means I started to have this problem. If you are thinking, oh, like if I'm driving now to my cottage, or if I'm driving for 2 or 3 hours, I will have to ask my family to stop somewhere for like a restroom break. That means you started to have these symptoms. Okay, so if you have any of these symptoms, or even if you have to use like a lubricant, if you start to have like any dryness down below, this is all symptoms that there is some changes that's already happening to your internal organs, and these changes have to be addressed. So vaginal dryness and pain during intercourse can be one of the very, very annoying symptoms. And the reason why this is annoying is it's actually affecting one of the very important parts in the relationship, which is having a healthy sexual relationship. So having a healthy sexual relationship is a very, very important, and it's a very, very fundamental part of the whole relationship. So there is actually a lot of studies that show me now that when this part stops from the relationship, it can actually affect everything. So in order to have a healthy relationship, you need to have a healthy sexual relationship. This is something that can definitely affect a marriage. It can affect the relationship between a wife and her husband, for example, or her partner. Maybe her partner doesn't really understand that she's going through some changes, so he's just looking for what he's looking for, and then when she's not able to offer it, he's not happy about that, and he doesn't understand that as a female, she might be suffering. Or she will suffer in silence. She doesn't want to say anything about it, because if she's saying anything about it, she might get mistakenly misunderstood. So this is a very, very important part. And the other thing that can also happen is changing the sensation. So with having the kids and having a lot of trauma that can happen to our organs down below, plus the aging and all of the lack of collagen and all of the things that we talked about, we can definitely expect some changes that happens to our sensation. So one of the very common things that will happen is changing the sensation in the orgasm and the change in the sensation of the pleasure that can come with having a sexual relationship. Why is that? Because the tissues are not becoming as sensitive as before. And once we lose the sensation, we're not really enjoying our relationship anymore. So if we're not enjoying our relationship anymore, and this same relationship can actually be a reason why we can have pain, that's not going to help. So this is why that's also one of the things that we need to talk about. Lubrication, hydration, but most importantly, definitely having the orgasm that can come with that relationship, which is basically reflecting on the pleasure and the sensation that comes with having intercourse. So incontinence, that's what we just covered right now, okay? So I will be talking about all of the solutions, maybe later on in details, but I just wanted to bring up the whole picture. And I'm sure that some of the people who are here are suffering from these symptoms. I'm not gonna lie, I'm in my 40s and I have 3 kids myself, so of course I started to have some of these symptoms. I already got my OSHA treatment before and I was super happy with my results. And I'm actually getting my laser treatment because we need that, okay? So I also wanted to talk to you about this one is a big thing, which is the low libido. So this is a concern I hear almost every single day in my family practice. So I lose my sexual desire, or I'm experiencing painful intercourse. Yeah, that's okay. So I get this question all the time. People are always asking, what can we do about that? So we need to kind of reverse engineer what we were just saying a few minutes ago. So if I'm not enjoying this relationship anymore, plus this relationship is giving me pain, do you think my brain will be excited to have this relationship? The answer is absolutely not. Why? Because your brain is trying to protect you from having anything that will cause any sort of pain to you. So it's definitely going to be blocked. Of course, it's a lot more than that, like hormone replacement, which is one of the things that I will touch upon briefly today, especially the low testosterone that we all have. And I'm saying that confidently because when I do blood work for anyone who's over the age of 35, 40, like hormone, like testosterone hormone is barely detectable in the blood. And that's actually one of the main reasons why the ladies will have this sex desire. And when we have low hormone, our desire will be very, very low, but just increasing your hormones when you're still in pain and not having any pleasure that comes with this relationship is still not going to help. So this is one of the complaints, that low libido or low sexual desire is one of the complaints I almost hear every single day. And unfortunately, when the ladies bring it up to their general practitioner or to a family doctor, what will be the answer? Like, did anyone try to get an answer before for this? There is more than likely there is no answer. It's just aging. It's just life. There's no medication to help with that. We just have to suffer and suffer. So this is why when I was hearing these complaints from my own patients in my family practice, I'm like, there must be something. Like, I don't want to be suffering when I'm their age. This is why, like, at a younger age, I even started to think like more in depth. Like, there must be something to help those ladies, because having this one single complaint can actually end the relationship. And that's a sad outcome, especially now when we have a solution for it. We don't want to hear like any relationship being ended because of that. So emotional impact, that's a huge thing. One thing that I also noticed it makes a big difference on the emotional impact is how do I see myself? And that's another thing. If I don't see myself as a good, successful partner for my actual partner, I will not be able to convince him that I'm the right partner. So emotional impact can actually have a huge reflection on my self-esteem, me being like anxious all the time, even the way I treat my kids and yelling at them all the time. That can also be happening because I always have something in my mind that I'm not the best person for this relationship. I'm not a good partner, which is very unfortunate because it's not your fault by the end of the day if you're going through the changes that every lady suffers from. And even if you never had kids before, you will still end up with these changes. It might just take a little bit of a time before it starts, but it will happen. So this is what I'm trying to explain, because we need to make sure that you are having the most support when we're talking about those very, very intimate concerns, okay? So we're gonna do some games now, and then through these games, we will be able to explain more, okay? So are you guys ready?
Yeah.
Okay. Do we have pen for everyone? I think we have pens here. Okay. Okay, great. So we're gonna ask some questions. Don't worry about it. There's no like, there is no punishment if you answer it wrong. But there is actually rewards. Oh, you can go ahead.
And I'm also going to hand around one more page just for some information, just so we can have your information. Maybe we can pass down. That'd be great. Hello.
Did they get your name?
Oh, okay. You can pass it down. Okay, paper. So great.
Thank you so much, Toby. Now, show them on this panel.
Did you get this one?
Yeah. Okay, so you guys are ready for the game? Okay. So we have some symptoms here, and then we have some complicated causes, and you guys will need to connect them together. Okay, so we have vaginal dryness, urinary leakage, laxity, low libido, and painful intercourse. Weak pelvic floor muscles, decline in estrogen, menopause, post-children's stretching and collagen loss, hormonal imbalance, the low testosterone, thyroid, and vaginal issues and thinning, and lack of lubrication. What do you think? Do you want to take a minute to kind of put 1 and A, 2 and B? Okay, you want to just answer it now? Or do you want to just put it here? Because we will have gifts for people. So if you want to just answer the question, that would be nice. So if you get them all right, you can have a gift. What's that?
What's the question?
Oh, right there. So these are the symptoms, okay? And then these are the possible causes. So vaginal dryness, for example, why do you think ladies will suffer from vaginal dryness? So choose between one, A, B, C, D, E, and so on. So you need to match 1 with, like, let's say A, B, C, D, E, and then 2, you're gonna do this match, okay? I know that it can be very confusing. It's not good at that, okay. Anyone wants to do the game? Maybe you will, okay, do the game. We're just gonna give them a minute. So we can give prizes for that. Okay.
Not dryness, that could be a couple things. It could be
I agree with you. It's all like
stretching,
yeah.
or decline in estrogen.
Okay. Yeah.
Maybe. Can you just want to see?
I think she's just doing 1 to 1, but you're right at the moment. Okay. Anyone was able to guess?
I guessed some.
Oh, you guessed the sum? Okay, great. Okay. So go to the answers now. You already have it?
Yeah.
Okay, so we will get you to correct your answers and let's see. Okay. So vaginal dryness is definitely because of the decline in estrogen. Okay. And then leakage, remember we were talking about the pelvic floor muscles when I said the muscles are getting weaker. So all of our organs here are pushing on the muscles that's already getting weaker. This is why we have this leakage happening sometimes, okay? And then vaginal laxity can definitely happen because of, I would say, if you get number A, it should still be considered right because it's the same like weakness in the muscles, but of course with having kids and the stretching and having like this pressure for 9 months and pushing on your muscles, it's making the laxity even worse. And low libido is mostly hormone imbalance. So we were talking about the low libido, so definitely having low sensation. We have an area in our private part, it's called the clitoris. I don't know if you guys heard about this before, but this clitoris is actually it's a very, very small, tiny area. This area is responsible mostly for the sensation. So this is what gives you, what's that?
It's called the clitoris.
Yeah.
Clitoris.
So this part is the part that's responsible for the sensation, the orgasm, the pleasure that comes with having intercourse. That can definitely play a big role on the desire. But the most important factor, excuse me, that actually affects the desire is definitely the testosterone hormone. It's very interesting because when I see ladies for HRT and I actually put them on testosterone hormone, I believe I'm maybe one of very, very few family physicians that can start ladies on testosterone hormone, but because I understand the benefit of that, they notice a huge impact on their sexual desire. This will be the first thing that they will notice. Of course, it also helps with energy. It helps to maintain our muscles and bone mass, which is one of the main reasons why we all need testosterone. Like we need to maintain our muscles. We don't want to have osteoporosis when we grow older. But it definitely has a huge impact on the sex desire. So that's one of the reasons. This is why when I get someone coming for, like, let's say, OSHA, for example, and you will say, will this reflect on my sex desire? I'm like, well, it's going to help a little bit, of course, because it's going to correct this sensation part, which could be one of the reasons why your brain is blocking the desire flow. Plus, of course, it helps with the lubrication and it helps with the dryness. But if you have very low testosterone, that's not going to be corrected just with the O shot. Sometimes we have to combine 2 treatments in order to get the desired results. Mm-hmm. Okay? So, talking about corrections and what we can do in order to correct these symptoms that we were just like talking about in details. Okay? Anyone has any questions so far? I just want to make sure that we're not like... ignoring any questions. Okay, so I'm trying to take my time just to explain things in details, so hopefully you guys are okay so far, but if you have any questions, please be free to let us know. Lifestyle and prevention, what we can do to prevent that. So of course, any factor that can get me to lose a lot of collagen will definitely exacerbate this process, okay? So smoking, for example, is a big thing because smoking will get you to lose a lot of collagen much faster. And of course, when you see someone who's been smoking, you will notice that they will get more wrinkles on their face because the smoking is affecting the collagen that's being lost from their skin. So as much as it's affecting the face, this is what we can see with our own eyes, but it's also reflecting on our internal organs just as well, and is affecting our muscle mass, and it's affecting our muscle fibers down below. So that's one of the things. The other thing that, of course, excessive exercise is good because it can help with strengthening our muscles. One of the things that we always recommend is called the Kegel exercise. This is exercise that's mainly designed for strengthening our muscles. So doing Kegel exercise even at a younger age is not going to be a bad idea at all because it's always good to maintain your muscle mass. Talking about lifestyle, this is a great thing, or like one of the questions I get asked a lot is, will Kegel exercise correct the problem? So I always say that it definitely helps to have some exercise because exercise is always good to strengthen your muscles. But if you want to really build your muscle in, like, let's say your arm, okay, and you're really dedicated that you want to build your arm muscles, how many times do you have to go to the gym, and for how long? You need to be going to the gym almost every day, or at least 5 days a week, and you need to be doing like a lot of weight and a lot of exercise in order to rebuild your muscle and to notice actual changes that's happening to your muscle. So in order for us to do that, physiotherapy can be definitely helpful. Kegel exercise can definitely be helpful, but in my opinion, it's more into maintaining what I have rather than actual correction to a problem we have. Why? Because if we're trying to correct the problem, it's going to take you forever doing Kegel exercise just to be able to see something. But it's a very, very good way to at least maintain my muscle mass. If I'm like doing regular exercise, if I'm doing physiotherapy, that's definitely a great idea just to maintain what I have, but it's not going to reflect so much on how I feel if I already started to have some symptoms. Of course, there is some vitamins that helps a lot with the collagen formation, like omega-3, for example. We have actually, there is some stuff I always recommend, like the zinc, for example, the ashwagandha. All of these are over-the-counter supplements that can help a lot with our hormone imbalance, and it can also help with our symptoms. But at the same time, again, like there is so much that you can expect from that. Taking collagen supplements can also be a very, very good addition to my daily routine if you guys do not take the collagen. The only thing with the collagen, we have to be very picky which collagen we choose, because not all of the collagen will actually help. And some collagen will be designed mostly just for the skin, so people feel happy that their skin is looking different. But it's not going to actually affect our internal organs. So it's also very, very important to choose which type of collagen. So if you have any questions regarding these supplements, please let me know. What's that?
Is there any one that you recommend for collagen that kind of works better for?
I actually take a liquid collagen, which I can show you which one, and I definitely recommend that one. And having that said, the ladies who are getting treatments with me for the O shot and for the laser, when they actually started these supplements, especially the collagen I was just talking to you about, they actually noticed a difference. Of course, the treatment will help, but taking these supplements will help to maintain everything. So I will definitely show you the supplements at the end, okay? And of course, avoid excess sugar, alcohol, and smoking, just like we discussed. Stress is a big factor because when we are under stress, we cannot function straight. It's just easy to say avoid stress, but we all know that we are living in a very, very high stressful level now. So that might be hard to avoid, but it's just good to know. Exercise and weight management. Okay, so weight actually is one of the things that can have a big impact. Why? Because when we have a lot of fat in our stomach area, that's actually weakening our tone in our muscles here. So one of the reasons why we have weakening down below is everything is connected to each other. So when we have weak muscles here, we actually have a lot of weakening down below. And this is why a lot of times when people have this normal vaginal delivery, they actually think that they are causing the worst damage to their pelvic floor muscles. But actually when they have a C-section, especially the very old style of the C-section when they used to cut the muscle, that was like so many years ago, it was causing huge impact on the pelvic floor muscles. So weight management is important. I mean, it's good to manage our weight anyway, just for like to minimize risk factors for diabetes, blood pressure, heart attacks, breast cancer, so many other types of cancer. That's all linked to being overweight. But when we're just talking about this problem in particular, when we have a lot of fat in this area here, it's definitely going to make it worse. This is why when we start doing some exercise, especially like core strengthening exercise, it can definitely make it better. The problem is when ladies go to the gym and then they leak, they stop going to the gym. So we get into this vicious circle. It's harder to improve things because when we try to improve it, it's causing a different problem that's impacting my mental health and how I feel. But this is another good thing. One of the things actually we do here is we have a very, very successful weight loss program. And I'm not sure if you guys have heard about it, but we actually had a lot of people here join us before for the weight loss program, and they had very great success with that. And one of the things that sometimes I ask the clients, how is this reflecting on their quality of life? And that's one of the things that we always hear, especially when we started to lose that fat in our muscles. And one of the treatments we do is the laser to tighten the muscles and to melt the fat. So this can actually reflect on the urinary symptoms just as well. So stress and sleep management, again, like it's great if we have like a stress-free life, but that's not easy to achieve. So we're trying to bring it up because just being under tremendous amount of stress is not good for you. So if there's anything you can do to minimize the stress, it's gonna be great. But I know that it's just much easier to say. Kegel exercise, we just talked about this, and pelvic floor strengthening exercise, that's also great. Again, as much as I always recommended this to everybody, but at the same time, we have to be mindful that in order to actually rebuild the muscles that has been like losing the collagen since the age of 21, 1 to 2% per year. So if I am 41 years old now, that means I have lost at least 20 to 40% of my collagen that's affecting my muscles. And that's going to be hard to rebuild just with the exercise on its own. Having that said, please do exercise because this will help to maintain it. Okay, so these are some pictures to demonstrate how we can do Kegel exercise effectively. This one in particular can be this one here, number 2. This one is very, very impactful. Plus, it also helps to strengthen our core muscles. So this can actually be great for our pelvic floor muscles, and it can also help our core muscles here. So you can definitely, this is easy to do in the kitchen. This is also like we have to do these kind of exercise during our day because sometimes when we dedicate certain time for the gym, it doesn't happen. So we just have to do stuff as we are going through our daily lifestyle. But this one in particular, I really like it and I highly recommend it. It's very easy to do. You can do like, let's say 20 counts and then every day you can just add more, okay? Physical therapy, we just talked about the physical therapy, and again, this is also other ways to help and correct our muscle core here, okay? Now, hormones are definitely having a big impact, especially when we are talking about dryness. So dryness is 100% linked to the hormones. So if somebody had to go through hysterectomy at a young age, for example, and they took her ovaries out, or if somebody's just going through a menopause, or even the perimenopausal changes that usually starts like around the age of 40, depends, everybody's different, but usually like 40, 45, ladies will definitely experience some changes in their hormones. Even if you are still getting your period, it doesn't mean that you are still getting the same level of hormones that you used to have when you were 25 years old. So one of the factors that actually affects the lubrication so much is the hormonal imbalance. And unless we go on hormones, there's not too much we can do about it. Hormones, it can be a good option. I always go with symptoms, even when I see somebody for HRT consultation, for example, I usually go with symptoms. Because realistically speaking, everything comes with side effects. So if you don't really have major complications that affecting your quality of life in terms of night sweats, hot flashes, like that's really, really interfering with your sleep, interfering with how you feel, maybe we need to start you on testosterone at this point, because this is going to help with your energy and it will help you to sleep better and it will help with your sex drive. And just talk about topical options for your vaginal dryness, so you don't have to go on estrogen or progesterone if you don't really need it. So I always don't push any medications on anyone. I always try to think about it myself as, if I am the patient, will I like to receive this treatment? And if my answer is maybe not, then I need to come up with other options to offer my clients and my patients. So this is why when it comes to hormonal imbalance, we can definitely talk about options that we have. If somebody has a very strong family history of breast cancer, for example, or you're trying cancer, somebody who has previous breast cancer, they are not good candidates to go on hormone replacements anyway. So this is why it's always good to have like a good assessment before we start any HRT treatment. Not everybody is a good candidate for sure. And again, the word that it's just aging is not acceptable. One of the things I would also like to touch base on when it comes to the vaginal dryness, which I personally tried it on a lot of my clients and I found a huge impact on their daily life, was actually the CO2 mask. I will have Nisha to talk about it at the end, but we've been having these products now for over a year and I've tried it on so many of my clients and they are all swearing by it. It makes a big difference with the vaginal dryness. So if this is the only concern you have, maybe you don't need to go on estrogen or progesterone just to correct one single problem that could be corrected otherwise. That's my recommendation. This is why, because we don't want to push hormones on everyone. So that's in terms of the HRT. Having that said, HRT, it can be like a game changer for so many ladies. With starting ladies on testosterone, it can correct a lot of the problems, not the vaginal dryness one. So this is why, again, we need to do a full assessment in terms of like your hormonal levels before we start any treatment, and more importantly, the symptoms you have. Pellet therapy is another thing I also do here. I do not know if any of you have heard about the pellets before. So pellets are also HRT, like hormone replacement, but pellets will be inserted underneath the skin and they will slowly release the hormone over 3 or 4 months. So it's just a one-time procedure and it will slowly release the hormone over a period of time. A lot of times clients love that because they don't have to remember to take their medication every day. Plus, the impact on their life is huge. Most of my pellets clients, they used to get it in the US. And now, as they started to realize that there is some providers in Canada now, not too many, but some are doing the pellet therapy, they started to get it here. It's so big in the US. Okay, another game. Okay, so only estrogen matters for women's sexual health? Yes or no? What do you guys think?
No.
No. Okay, so why did you say no?
Testosterone also is important.
Yeah.
And then many other hormones.
That's true. Estrogen is the key when it comes to vaginal dryness for sure, but testosterone actually is the one who has the biggest impact on the sex desire in particular. Progesterone, we use it mostly to protect the uterus when somebody still has the uterus, but you cannot take estrogen on its own. Okay, another question, the thyroid gland can influence sexual energy and mood.
Yes.
Yes.
It does, yeah. And hormone therapy is unsafe for all women over 50. Yeah, okay. Pellet therapy can provide consistent balance for months at a time. Okay. So did anyone answer anything? Oh, okay, oh, somebody are so dedicated to answer the questions right. Okay, no cheating. Okay. You guys got them all right. Okay. So, I want to talk to you more now about the treatment and why do you offer this treatment and what's included in every treatment. Okay, so we talked a lot in details now about the dryness and we talked about the laxity in the muscles and we also talked about the hormone imbalance that can also affect how we feel. Okay, so one of the options I want to talk about is the O shot. And I don't know if you guys heard about the O shot before. Who heard about the O shot? You heard about it. Okay, okay. It's very interesting that some ladies haven't heard about it so far. So, O shot is actually stands for orgasm shot. And basically, I know that once you hear the word shot, it will just kind of make you so concerned that it's gonna be very painful procedure. But in real life, I personally had this treatment before, and I didn't find that it's really, really painful, simply because the vaginal wall, where the injection will be mostly done, is not sensitive. So I know the feeling of having a shot is not a very pleasant feeling, but the pain level will be very, very minimal compared to so many other procedures. So, anyone heard about PRP before, or anyone know what PRP stands for? It's platelet-rich plasma. So that's basically what the O shot is all about. So we use PRP treatment for a lot of things over like the medical field. When PRP came out, it was actually made to be used mostly in OR because it helps a lot with the healing. So they used it mostly for operating room, for the bones, the surgery, because bones are a little bit harder to heal. So they used to put the PRP around the bones. So they know that when we use the PRP around the bones, the bone will actually heal so much better. So PRP stands for platelet-rich plasma. The way we do the PRP simply is we draw the blood from the client, and then we put it in the centrifuge. Once it spins the centrifuge on a very, very high speed, that will split the red blood cells from the plasma. The plasma is this part here on the top, that kind of clear yellow gold color. We call it liquid gold. And this plasma is the part that will be injected. So we actually use PRP for everything from head to toe. We use it for hair, face, under eye treatment, neck. We use it for the non-surgical breast lifting. We also use it a lot for orthopedics. Like I get a lot of people with knee osteoarthritis and shoulder pain. They get the PRP treatment, and it works really good for them. And of course, we use it for stimulating the collagen in our private area. So we use it for male and female, by the way. Like we have the same thing for male. It's called the P shot, which actually is a great way to get them back to their performance. But for female, we take this plasma here, this part here, and this is the part that will be injected. So part of it will go in the clitoris part, which is the part that's responsible for the sensation. Whenever we inject PRP anywhere, whether it's hair, face, joints, doesn't matter, it's doing the same thing. Healing, stimulating collagen, stimulating circulation, stimulating nerve endings, and stimulating like whole rejuvenation for the cells. So it's basically reversing the aging that's happening to this cell. So part of it will go in this tiny small area, but it will mostly go inside the vaginal wall. This is why I'm saying this doesn't actually hurt almost at all inside. Everything definitely is being sewn on, so people are usually very comfortable. I usually say that if you ever had Botox before, usually Botox hurts more than the shots. If you had Botox, you probably know that Botox barely hurts at all. So this is gonna go inside the vaginal wall. What's gonna happen when we do the injection in the vaginal wall? It's gonna do what we just said, stimulating collagen, stimulating circulation, stimulating the sensation, and basically reversing the aging process from where I am now, which could be like, let's say 45, 50, 60, doesn't matter, bring things backward to where I used to be like maybe 10 years ago, 20 years ago. So this is kind of a natural rejuvenation. And where is this PRP coming from? From your own blood. So chances for anything to go wrong with this treatment is very, very, very unlikely, because we're just using your own plasma to be injected back to you. So this is a great procedure. It helps a lot with the sensation, and it helps a lot with the dryness. I find that when we combine it, especially with the CO2 laser, you can get very, very, very great results in those two terms in particular. Now the other one which I love so much is this procedure here, and this is the laser. The laser goes inside your vaginal wall, the same way you can actually see it here. So same idea, we numb your vaginal wall, so it will all be numb, and the procedure will be pretty comfortable procedure. But the whole idea here is we're trying to prevent the laxity and the weakness that's happening to your muscle. So if any of you have ever had any laser treatment for the face, for example, when we do laser treatment for the face or for the neck or for any other part of the body, what we do is we stimulate the collagen. So when the collagen is being stimulated, we are restoring the collagen that used to be in the cells. So you will notice this nice lifting and tightening happening again to your skin, same way we looked when we were younger. So we're doing exactly the same thing. The laser beam will be going through the handpiece here. Of course, we have this glass speculum around it just for protection. So the actual metal doesn't touch your skin. It's only the glass. So the laser beam will be releasing the laser to the whole pelvic floor muscles. And once we do this, you will definitely notice this tightening and lifting. So basically the laser is stimulating this energy to stimulate all the collagen around it and stimulating all of the muscles. So this gives you this nice tightening and lifting that will actually give you this instant results. And this result, of course, it can last with you for years. So a lot of times when we do this treatment, a complaint that I've heard about is they might get a little bit of loose bowel movements. That's the complaint for the next 2 days. And I always say, okay, so when the laser is stimulating everything, the laser cannot just be sending the beams to your muscles and ignoring your bowels. Like it's sending the beams to stimulate everything. So sometimes, I haven't heard it so many times, but I mean, that's one of the things I heard before, which is having a little bit of loose movements for the next 2 days. Not like real diarrhea, but it can just be a little bit loose, but that's because the treatment is strong enough to stimulate everything. So when we are stimulating your bowels, you can actually have a little bit of loose bowel movements. The other thing is sometimes because of the topical irritation that can happen to the vaginal wall, you can have a little bit of vaginal discharge just for 2 days after the procedure. I will say out of like maybe 20 treatments, I might hear this just once. So it's not something that happens all the time. And if it really happens, like usually it stops on its own within like a day or two, but just in case it happens, like I usually prepare my clients so they know exactly what to expect. This treatment is amazing in terms of the lifting, tightening, urinary incontinence. It's phenomenal. So usually one treatment will give you very, very good results. It's very interesting because I always take the pictures before and then I take the pictures immediately after and then I show my clients their before and after. That's like 20 minutes far or like 25 minutes. And it just blows their mind that that's just happening on the same day. So this is the instant result that you see, but keep in mind that the actual collagen stimulation takes even more time to happen. So like let's say 3 months from today, like let's say you're having your procedure today, 3 months from now, you will even experience more results. Why? Because the collagen stimulation takes quite some time to happen. Same as when we do the PRP. I always say when we're trying to do any collagen stimulation, this is like you planting seeds. If you're planting the seeds today, you're not going to see the plant tomorrow. Like you're planting the seeds today, but then you need to give it a couple of weeks for things to start to grow. And even when the plant grows, it grows small and then it starts to get bigger and like larger with time. So we usually say the process of collagen stimulation will take minimum of 4 weeks to happen. It can take 8 weeks for some patients. It can take up to 12 weeks or even more. So your results 3 months after the procedure will actually be much better than 2 weeks after the procedure. So you see this instant results, which keeps you like excited, but results even gets better with time. We also have the radiofrequency. I just want to show you here. Maybe we can turn the volume a little bit low.
More?
So this is just going to explain to you how this happens. So far, I'm the only one who's doing this treatment at the clinic. I'm trying to train my nurse so she can do mine. That's basically what happened. So if you ever had a pap smear, it's very, very similar to the idea of the pap smear. Like we have the speculum that goes inside and then the laser will go inside. Except of course with the pap smear, like the doctor has to use the brush and that can be a little bit uncomfortable. Here we don't use the brush. It's just a second.
It's not painful.
It's very minimally painful. I will say a little bit of discomfort, especially with aging and the hormonal imbalance. If somebody is really, really dry, I actually give them prescription for estrogen cream to use 2 weeks prior to the procedure. It makes it a lot more comfortable, because if somebody is really, really dry, it might even be harder to put the sticker on it. But that's only for people who had menopause for the past, like let's say, 25 years, for example. Okay, so this is for a kind of demo how this works. There is another treatment option. It's the vaginal radiofrequency. So radiofrequency is another option that we also have in aesthetic medicine that helps a lot with tightening and lifting. And it's very interesting when we do the forma, like radiofrequency for the face, for example, we do the treatment and then people will see that the lines are actually disappearing right away because of the collagen stimulation. So that's amazing, right? It gives them this like kind of instant lifting, and they see the difference like right away. So we do the same thing with the vaginal one. So we just go inside, same idea. So that's basically how big the handpiece is. This goes inside and it has the radiofrequency tip. So the radiofrequency will go inside and that will do the tightening and the muscle stimulation and all of that. Those are, in my opinion, combining the laser for the radiofrequency with the O-shot is going to be the best combination ever, because we're stimulating a lot of collagen stimulation and a lot of circulation and sensation, and at the same time we're also offering the tightening and the lifting and this instant like results that we can see. So I'm going to just show you how this looks. That's the treatment for the RF. I also have to say that you will think that people are coming for this procedure in their like 60s and 70s. Actually, most of my clients are in the age of 35, 40, all the way to maybe like 65, 70. I rarely see anyone who's over that age. And when I see anyone who's like 75 plus, I have to do a good assessment for them, because sometimes when you wait and wait and wait, then you have to go for surgery. Like it's too late for anything to be done. And that's what we're trying to avoid. We're trying to avoid waiting too long up until we lose all of the muscle power, and then you basically have to go for surgery. So just for the fact of the time, we'll just have to skip that one, but it's just very similar to the other one, okay? So, O-shot, the photon, the laser, and the RF, you can definitely combine them to get the best results. Through the years of my experience, I find that every single one treatment can do everything. So if we're just talking about, like, let's say the photon laser will help a lot with the dryness, it will help with rejuvenation, tightening, everything. But I just find that one specific treatment can be very, very specific about this one extra step. So for example, if we're talking O-shot is amazing for the sensitivity, for the orgasm, and of course it's also amazing for the dryness. The laser is great for the collagen stimulation, the tightening. I actually had one of my patients, she was 37 years old, she just had a baby, she ended up with a big cut after the baby that gave her huge pain. So when I actually started to see her, that was when her son was 6 months old, and she wasn't even able to have sex since her son was born. So she came in with her husband, and she was like, you have to do something about that. So I started her actually on the laser first, and then we started to do the O-shot. So we did a combination of both, and she was happy at the end with her results. She was able to restore her life back. Imagine if somebody is just like in her 30s and her husband can't even touch her. Otherwise, she will be screaming in pain. Yeah. So it can be as bad as this sometimes. Supplements, we definitely need to talk about that briefly. So we talked about the collagen, omega-3, antioxidants. All of these supplements are important because we need to keep ourselves like healthy. Let's be honest, nobody is eating like the best food ever. And even if we try, but the whole community is not helping us. Like you take your kids out for the park, for example, they want to eat this ice cream, and like even when you go to grocery store, like everything is not usually the best quality. So a lot of times we have to take these these supplements because our body cannot do it on its own. So we have a list of supplements here if you guys want to take like a screenshot or if you want to write them down. But we also have a lot of things here that I would love to show you at the end. Mostly the ashwagandha is actually a great one. And vitamin B12 is amazing for the energy. Vitamin D3 is great for our bones. It's great for our mood. It's great even for our memory. So we do actually vitamin D shots because a lot of times people will take the supplements and their D level is still low. That's because the absorption of vitamin D, same as B12, the absorption is a little bit complicated. And for vitamin D to be absorbed, it has to be combined with like a fatty something. Like this is why I always ask my clients to combine it with the omega-3 because we need to combine it with the fish oil. But there is actually some studies that confirming that low vitamin D can play a big role in dementia. So we have to be more proactive. We don't want to wait for things to happen and then we try to correct it. Because unfortunately, a lot of times by the time we wait for things to happen and then we try to correct it, it actually gets too late. One of the supplements I also want to talk about is so the maca root is actually the ashwagandha. I like it so much. It helps a lot of people to even have a better sleep quality at night. And it also helps even with the, again, like the sexual function. It helps with the desire a little bit, with the energy. That can definitely be in combination with so many other things. Probiotics and gut health. Actually, talking about probiotics and gut health, a very exciting news is we're actually bringing peptides to the clinic. I don't know if you guys heard about the peptides before, but everybody in the US is talking about it. We have only 3 peptides that started to be Health Canada approved. So those are the only 3 peptides that I'm bringing to the clinic here. One of them is oral tablets, and this works phenomenal for the gut health. It works great for the energy because when we have good internal organs, we will be feeling good. So probiotics are definitely great, but if you are interested in the peptides, please let us know because we will be offering peptides that already please our organ and we are excited to have that. So one of them is the oral one that goes into the gut and it cleanses the gut. One of the peptides is a cream. This cream is doing nothing but collagen. It's phenomenal. And we can even combine that with retinol, we can combine it with vitamin C. So this can be like a perfect anti-aging cream, goes hand in hand with everything else we can offer, or you can just use the cream if you're not interested in anything else. Another game time. Okay, so the collagen, do you think it's important for the bone strength or for the skin and the tissue elasticity?
Bone strength.
Okay.
Skin.
Skin and tissue elasticity, yeah, that's true. And this is why when we use the collagen, that can actually play a big role in terms of the vaginal laxity. Okay, how about vitamin D? Do you think it's important? Yeah, mood and hormone, yeah, not for the vision. Vitamin E is for the vision. Maca root is great for libido and energy, great. Probiotics, vaginal and gut health or muscle growth. Yeah. Okay, great. Well, you guys are so good. Everybody's gonna get a gift here. Okay. So aging and menopause is another one. So we talked about this. I don't want to just repeat myself. So we talked about the hormonal changes. We talked about everything that can actually affect our health and the symptoms that can affect us. And how menopause affects us, it's so many things. Like we hear about the mood swings, the vaginal dryness, the changes that can happen to our hair, the brain fog, bone loss, weight gain is a big one. So it's hard to tell how many ladies I see every single day that's complaining that I'm putting on weight and I cannot take it off. I'm eating right, I'm going to the gym 5 days a week. So I'm not sure if any of you has experienced this, but weight gain is actually an aging complaint. So as we get older, even if you're eating exactly the same food that you used to eat before.
In your 60s.
Well, actually from the, I would say, late 30s, you started to have some issues with the weight and building fat in unnecessary or like unwanted areas. It becomes a real problem. And that's what I always have to explain to people when they join our weight loss clinic, because we try to do everything we can do. We give them supplements, we give them the B12 shots, the MIC shots, the glutathione to cleanse the visceral fat, so they notice a huge difference. But it's a big discussion, like weight in particular is a big discussion. So hormonal imbalance can cause all of this, hot flashes, thinning in the hair. That's another aging problem, and not necessarily taking vitamins will help. When I see someone for HRT, I always make it very clear, don't go on hormones to lose weight, because it's not going to help you to lose weight. Even though it's part of the hormonal imbalance problem, but being on hormones, even if it's bioidentical hormones, it doesn't help you to lose weight. To lose weight, we need to do other things. So we usually consider menopause if you haven't had your period for a whole year. This is when we usually say this is menopause. If you start to have a period after a whole year of being like on a break, you definitely need to let your doctor know, because at that time you will need to have something called endometrial biopsy. That's if you go for a whole year without a period. And of course the dryness and urgency and incontinence and everything that we discussed. So non-hormonal solution, I'm a big fan of any non-medication option, even though like I prescribe medication all day long. It's funny, but I personally don't like taking unnecessary medication, and that's how I always think about it. Like if I was the patient in front of this doctor, this is what I would like to hear. We want to try non-medication first before we can actually start introducing medications. So this is why I love non-medication options like supplements we just talked about briefly. The CO2 is an amazing option. Again, non-medication to stimulate the collagen and to bring the lubrication back to the vaginal wall. And of course, all shots, radiofrequency and laser are great ideas. Pelvic-floor muscles and physiotherapy is definitely great for maintaining what we already have. So we talked about this. Okay, so we're going to take a little bit of, this is, I believe this is the last game we have for you. Well, before we do this, I just want to ask if anyone have any questions so far. You're all good? Okay, and if you don't want to say your question out loud, you can actually write it down and we will have it here in the box, and then I can still go through them, okay? So for the shoulder roll, okay, so this is mostly talking about exercise and what you can do in order to kind of build your muscle tone. So I'm going to actually skip this one because of the time. So what our clients have gone through, it's never too late. So it's never too late is a very good thing to say, because I have seen ladies, again, like when I see someone who's like, let's say over 75, I have to do good assessment for them, because sometimes they really need a surgery. But if someone doesn't want to go for surgery, or if someone wants to try first any non-surgical option, we still get some results. So one of my patients, she was in her 80, I believe she was 84 or 85, and she didn't have like complete like clearance to 100% of her symptoms, but instead of her waking up every 2 hours to use the washroom, she was able to go through the whole night, only waking up once in the middle of the night, and then she was able to sleep. So for her, this was like a whole like change in her quality of life. So at least she didn't have to go for surgery this way. Another patient I had, she was waking up every single morning and she wouldn't be able to make it to the bathroom. So she would not have like interrupted sleep, but she wouldn't be able to make it to the bathroom. So she's almost having an accident every single morning, which was very, very embarrassing in front of her family members. So when she had the treatment, that stopped. So for her, that was like a big change in life. So it's never too late to get into having the orgasm, and it's never too late to get into this break in terms of like your emotional break and in terms of sleeping good. So we were able to help so many ladies with all of these treatments I just mentioned. I always try to bring everything to the clinic, so this is why we talk about some supplements, we talk about some non-surgical options as well. So we have this video playing? We have this one here. So can we play this video?
Yeah. Can you press that?
No, it's taking me to the next slide.
Oh, the mouse is in front of you. Can you click on it?
Hmm?
Like the keypad is in front of you.
No, it's just taking me to the next one. So this lady in particular, she actually mentioned that for so long she was thinking about the procedure. She actually okay. So it's playing now.
Most of my life, I've had problems with my bladder. I've already got worse. And basically, for the last couple of years, and since the pandemic, when there was no bathrooms, I just basically gave up the satin. I haven't been out much. I don't go anywhere much. And I've lost a circle of friends because I didn't want to go. It was just so embarrassing. Every time I went out, it was like, okay, where's the bathroom? The vaginal radiofrequency. The doctor was saying last week, and I'll tell you, it's the difference of night and day. I've been from going every 20 minutes to the bathroom to every couple of hours now. I don't pee when I cough, and I don't pee when I sneeze. And I'll tell you, it's with everything of it. Today I have old injection. So, yeah, ladies, do it. It's worth it.
So she was actually saying something very interesting to me, but I don't think it's in this video here. It was in a different one. She was saying, for so long, I was thinking I cannot afford to do this treatment, but at one point I started to realize I cannot afford not to do this treatment. Because it makes a big difference. We have another testimonial that I will have to skip for now because my client preferred not to have it posted online. So since we have our friends online, we're going to finish the whole discussion, and then she doesn't mind sharing it with our in-person client, but she doesn't want to share it on the social media. So I just have to respect that. So I'm just going to maybe skip that quickly for now. Yeah, that's another one. So this is actually a different client. She was talking mostly about the weight loss and her how happy she was with the weight loss.
Here and support it and program itself and people that work here because I'm kind of all wonderful. I always feel cheered on. I always feel success even when I'm having a bad day. It's really very good. And to be on such a culture. I've been on this journey for a long time. It feels like so. And so finally, it's nice. That's great to hear. So you mentioned that you were really trying to really what was trying to people and you were trying to do it on your own. And what was your process of that? I have tried a little bit of everything. Diet, already online, hunger blockers, you name it. I've ordered it, I've tried it, it's probably still my third. And now the all you need but I just realize now that the person started out at 172 pounds when I joined this program, and today I'm at 135. Wow. 27. That's a huge success. It really is, and I feel so good. It's overall health.
Feeling so good is the most important thing. And it's very, very important to like how you feel about yourself.
Oh, goodness. I noticed it in so many ways. Energy level, just little things like running up the stairs that used to be difficult and aren't now. I am a young grandma, so I obviously not real grandson, but I can not really shake around now. Just overall positivity, happiness for myself is such a personal goal, and I do a lot of things for my family. This is a big one, and I'm so very proud of myself, and it's so good to feel that way, and
So that was like a reward for yourself.
Oh, definitely.
That's amazing. Thank you so much, Amanda, for your feedback. Really appreciate that. You also talked to me about the education material that we shared with you.
Yes.
And
very helpful. Even for my initial consultation, I was told about the fasting, and I started that right away, and that came with 10 pounds, that came off really quickly, but it was a good kickstart. I continued the fasting, and then I received information from you about portion control and things that I should put in my parts.
okay.
And read so many times, it takes 21 days to change a habit, but you really have to have focus and know what habit you're changing.
Mm-hmm.
What are you getting rid of? What are you bringing in when you don't have I'm glad to hear that.
So one thing I have to comment on here is we invest a lot in educating our clients. So this is our before and after, so I just have to stop that for now. We really invest in educating our clients because I find that when you are like very, very educated about what you need to do, you will be more involved. And if you're not involved, if you're not committed, we cannot do anything. Like we can't do everything on our own. We have to have you and us working together, and when we work together as a team, this is when things start to change. Whether it's for the weight loss program or whether it's for like vaginal rejuvenation or any other treatment. Now I have some before and after, but maybe before we place the before and after, we just have to turn the camera a little bit because we don't wanna have it posted online, unfortunately, because I feel like it's not the best thing. However, anyone who's joining us online, if you wanna see these pictures and if you wanna have them like reviewed by yourself, you can definitely feel free to stop by the office. We will be more than happy to share those. Just before I place the before and after, those are actual real clients who we saw here. I'm not just like giving anything from the company when they give you like some results. This is like our real clients that I would like to share with you. And those are the immediate results I was just talking to you about, but then again, like results gets better as the collagen is being stimulated. Now, Randy, is this ready to go now? Like, did you switch? Okay, perfect. So this is here is before, and this is immediately after. So if you can actually see the difference in the tightening and the lifting, this is what's happening on the outside, and measure what's happening on the inside that's pulling things backwards. This is another one before and after. As you can see here, there is a lot of rejuvenation to the labia majora, and it's also showing you like how things are being lifted up. I don't know if we need to maybe change the lighting a little bit, just because we need to make sure the screen. Do you see better now? Maybe you can actually see how like the whole like skin is being rejuvenated around, and the amount of lifting, which means like things are being pulled upward, is a big thing. This lady actually, she had both the O-shot and the laser, and you can definitely see a huge difference on the outside appearance as well as the whole thing. Again, like things are being so much lifted, it's much rejuvenated. That's another one. And believe it or not, these pictures are only like 20 minutes, 25 minutes apart. So they have this nutritional anti-inflammatory diet. Like we touch base a lot on these resources when somebody is coming for the weight loss. We talk about what should be on our plate and what we should eat and what time we should eat. So collagen-rich food. This is all great, but sometimes I feel like we have to go for this supplement just to make sure that it's getting into our system. Sometimes we just have to go for this extra step. So we talked about the exercise, the balance. So I think we might have to skip that one because I want to make sure that everybody is being comfortable with the questions. If anyone has any questions so far, do we have any questions from anyone online?
Yeah, there is 3.
Okay.
One from Marianne. Are there any risk or side effects to watch out for?
So, like I just said, we're not injecting you from anything from the outside. So if we're talking about the O-shot is just your plasma that's being drawn from your blood. We just have to put it through the centrifuge, and this plasma will be injected back to you. So the risk is very, very minimal, like it's close to none. The only thing is you might just feel a little bit of a pinch. That's after the numbing is over. So after the numbing, like usually during the procedure, people barely experience it. But after the numbing is over, you might just feel a little bit of a pinch. Laser is the same thing. There is a downtime though, especially for the laser. I have to tell you, we usually ask people to abstain from any sexual activity for a week after, because the laser is very, very strong. So the wall will be like a little bit irritated. We cannot do any irritation to the vaginal wall for a whole week. We need to give it enough time to heal 100%. But we're not injecting you with anything. So for you to have any risk, it's close to none. Like it's almost nothing, which is, it's a very pretty safe procedures. Same as the radiofrequency. Again, we're not injecting you with any medications. There is nothing that's being introduced into your body, like nothing that's coming from the outside. It's all ways to stimulate your collagen formation through the heat or through the laser or through your own plasma. Do we have any other questions?
Kat says, what concerns does each treatment help with the most?
What concerns?
Yeah, like for each specific treatment, like what does it do?
So, like we just said during the session, like mostly the O shot, I will definitely highly recommend it for people who are having dryness and maybe low orgasm. That's gonna be like the best one. If you're mostly complaining of laxity, if you're complaining of leakage, if you wake up in the middle of the night to use the washroom, if you have to avoid going to the gym sometimes, I will think at that point you will be a very good candidate for the radiofrequency or for the laser. What I always do is I always start by doing assessment, which is examination to my clients, like kind of using my fingers to do examination, and then I ask them to cough. So when you're able to cough during that time, I can actually check how strong your muscles are. And then based on the assessment, I can definitely tell you during this time which treatment it will be best for you. But like I said, like every single treatment can help with all of these symptoms, but I just find that one treatment can be really best at that. Do we have another question, Razi?
And the last one is by Megan. How do these compare to surgery?
Okay, so surgery is surgery. So we're not talking about any surgical options at this point. We're talking about someone who's like in her midlife. She's not planning to go for surgery, but she doesn't want to live this way. Surgery is usually a very, very last resort when you are like really in a very late stage and you cannot live this way. You have to have the surgery to lift your bladder up. That's one thing. The other thing is surgery has nothing to do with the vaginal dryness. So if you have vaginal dryness, the surgery has nothing to do with that, because surgery is not going to correct your vaginal dryness. What the surgery will do is it will be lifting up your bladder. And when we lift up the bladder, that can definitely help with your symptoms. Having that said, not everybody is a big fan of surgery. It's a big surgery. And the other thing you also have to keep in mind, Megan, is when you have the surgery doesn't last forever. The surgery will only last for few years, and then usually after like maybe 10 years, 12 years, you will find that your symptoms are back. So if somebody, for example, is in her mid-40s and then she goes to surgery, if she qualifies for it, then that means by the age of maybe 55, she will have to have another surgery and then continue on. So if somebody is in this age group, we definitely want to try all of the non-surgical options before we just jump to the surgical option. Okay, do we have any other questions?
That was it.
Okay. That's what we try to do here, empowering women through education. So I will also like to hear your feedback, and I would like to hear like how you guys found this presentation today, and if you find that it was too long, it was too short, if you got your questions answered. And the other thing I will also like to ask you, if you have any other topics that you would like to have them discussed. I would really love to have this education events like on regular basis, and that way we can help to educate the community. If you feel like, oh, like I wanted to know more about this topic, I will be more than happy to prepare for it and have it presented to you, so at least we know that we are tailoring to your needs, okay? So I would really love to hear that. We definitely try to do personalized care here at everyone, so I'm happy to have some of our clients who have been here in this room, and I hope that you give us your feedback as well. So that's one of our training days. So one of the things I also do sometimes is I train other nurses and healthcare professionals on how to do these procedures. So I'm one of 2 trainers in Ontario who are actually certified to provide this training. So that's one of our training day, and I was just explaining to the nurse how she can do the procedure, the steps one by one, and we had a couple of models to teach her. She already started to do this procedure at her clinic. This training, this very last one, was just a few weeks ago, and she already started to have happy clients, which makes me very, very happy. Just be able to help other ladies. Her clinic is in Toronto, so I'm happy that we're able to help like people all across. So some takeaways: confidence, comfort, intimacy. I would really like to hear your takeaways. If you have any takeaway or if you have any question. Anyone has any comment? You're all good? Okay, don't be shy. If you're shy, you can always put it here. I'm just gonna ask you to see if there's any question that we need to cover here. And if you have an answer. So, is this treatment covered under insurance? Okay, so that's another good question. So, some clients will have something called a health spending account. So if you have health spending account, usually your health spending account will pay for any medical procedure that will not be included in like medication and physiotherapy. So a lot of our clients who have the health spending account, they can actually use it towards these procedures. If you do not have health spending account, you can definitely talk to your insurance. We do not deal with insurance directly. But if you don't have any health spending account, always keep in mind that this procedure is considered a medical procedure that's not covered under OHIP, which actually means that you still can claim it from your personal taxes because it's a medical procedure. What's that?
You cannot claim it to tax.
You should be able to.
You should be able to.
Yeah, you should be able to because we give you an invoice coming from a medical clinic saying that you had a procedure for medical purposes because it's definitely a medical purpose. So you should be able to claim it from your personal taxes. But some people who have, I have a lot of clients who were able to do that. Yeah. A lot of clients who have the health spending account, they can claim that through the health spending account. Another question is, how long does the treatment last? Okay, so anytime we stimulate collagen, whether through the O shot or the laser or the radiofrequency or even in the face, whenever we try to stimulate collagen, we believe if you're doing your best, like taking the supplements, avoiding smoking, alcohol, sleeping good, and all of that, we know that this collagen can last for minimum of 2 years. So that's why we usually say that the results can last for that long. Having that said, aging process is a continuous process. Like we don't stop aging. So just like you take your car to the service every few months and you go to the dentist for cleaning to take care of your teeth, after you finish your original treatment, we also will always recommend that you come for maintenance therapy. The maintenance therapy can be every 6 months, every maybe 12 months. It depends on where you're at with your symptoms. So if you have, like, let's say 4 treatments, usually that's what I recommend, so that way we can do like a combination of O-shot, vaginal, radiofrequency, and laser. I find that having 4 treatments can be optimal because we can like mix and match between the treatments and give you the best results possible. After you finish this package, you can come, like, let's say in 6 months just for maintenance or in a year for maintenance, simply because your aging or the aging changes will continue to happen. So we have a very special pricing for today, which I will also, thank you so much for attending, but I also would like to give you these prices that's just for today. And